Have you ever wondered whether every medical test your doctor recommends is truly necessary after the age of 65? Most people assume that more testing automatically means better health. We are taught that frequent screenings, scans, and examinations are the safest path to a longer life. But what if some medical checkups can lead to unnecessary stress, false alarms, risky procedures, and treatments that may do more harm than good? Today, we're exploring a fascinating and often misunderstood topic: the 5 medical checkups that many doctors would think twice about getting after age 65. Before we begin, let me be clear. This is not medical advice, and no one should stop any test or treatment without speaking to their healthcare provider. Every person is different, and medical decisions should always be personalized. However, understanding the risks and benefits of common screenings can help you make smarter, more informed choices. As we age, our bodies change. What makes sense for a healthy 40-year-old may not make sense for someone in their late 60s, 70s, or beyond. Medical science continues to evolve, and experts are learning that some tests once considered routine may offer little benefit to older adults while exposing them to unnecessary complications. The first checkup many doctors question is routine full-body CT scans for people who have no symptoms. These scans are often marketed as a way to catch diseases early, giving people peace of mind. At first glance, this sounds like a wonderful idea. After all, who wouldn't want to discover a problem before it becomes serious? The reality is more complicated. Full-body scans often detect tiny abnormalities that may never cause any health issues. Doctors sometimes call these findings incidentalomas. Once discovered, these harmless abnormalities can trigger a chain reaction of additional tests, biopsies, and procedures. Suddenly, a person who felt perfectly healthy becomes trapped in months of appointments and anxiety. Moreover, CT scans expose the body to radiation. While a single scan may not be dangerous, repeated exposure over time can increase certain risks. Many physicians believe that unless there is a specific medical reason, routine full-body scans often create more worry than benefit. The second medical checkup many experts approach cautiously after 65 is routine PSA screening for prostate cancer in certain older men. Now, prostate cancer is a serious disease, and screening has saved lives. However, age matters when evaluating risks and benefits. Many prostate cancers grow extremely slowly. In older adults, some prostate cancers may never become life-threatening. Yet a positive PSA test can lead to biopsies, surgeries, and treatments that may cause side effects such as urinary problems or sexual dysfunction. This does not mean PSA testing is always bad. It simply means that the decision should be individualized. Doctors increasingly encourage discussions about overall health, life expectancy, family history, and personal preferences before ordering routine screenings. The third checkup that deserves careful consideration is annual cardiac stress testing in people who have no symptoms and no significant risk factors. Stress tests can be valuable when chest pain, shortness of breath, or heart disease symptoms are present. But using them routinely in healthy individuals may not always provide useful information. False positive results are common. A false positive result suggests there may be a heart problem when none actually exists. This can lead to invasive procedures, unnecessary medications, and emotional distress. Many cardiologists agree that testing should be guided by symptoms and risk assessment rather than fear alone. The fourth checkup some physicians avoid is excessive bone density testing performed too frequently. Bone density scans are important tools for detecting osteoporosis. However, repeating them every year in low-risk individuals often offers little value because bone density changes slowly over time. Medical resources are most effective when used wisely. Testing too frequently may increase healthcare costs and anxiety without improving outcomes. For many older adults, longer intervals between scans may be more appropriate, depending on their risk factors and medical history. The fifth medical checkup that many doctors reconsider after age 65 is routine colon cancer screening in very elderly adults with significant health problems. Colon cancer screening has undoubtedly saved countless lives, yet there comes a point where the risks of preparation, sedation, and possible complications may outweigh the potential benefits. Experts often evaluate factors such as overall health, functional status, and expected lifespan before recommending continued screening. For some older adults, screening remains beneficial. For others, the burden and risk may exceed the likely benefit. What ties all five of these examples together is a powerful lesson. Good healthcare is not about doing more. It is about doing what is most likely to help. The goal is not to collect as many tests as possible. The goal is to live well, stay informed, and make decisions based on evidence rather than fear. Many people believe that declining a test means neglecting their health. In reality, thoughtful healthcare often involves asking questions. Why am I getting this test? What are the benefits? What are the risks? How will the results change my treatment? These simple questions can lead to better conversations and better outcomes. The wisest doctors understand that medicine is not one size fits all. What works for one person may not work for another. Age, health status, personal goals, and quality of life all matter. The best medical decisions are made when patients and healthcare providers work together with honesty, knowledge, and mutual respect. Growing older should not mean living in fear of disease. It should mean becoming more informed, more confident, and more intentional about your health. The most valuable medical care is not always the care that does the most. Often, it is the care that does exactly what is needed and nothing more. As you move through your 60s, 70s, and beyond, remember that wisdom applies to healthcare just as much as it applies to life. Ask questions, seek understanding, focus on prevention, healthy habits, meaningful relationships, and regular communication with trusted healthcare professionals. Those choices will often have a far greater impact on your well-being than any test or scan ever could. As we grow older, many of us become more focused on our health than ever before. We schedule appointments, follow medical advice, take medications, and undergo screenings with the belief that staying proactive is the key to living a longer and healthier life. There is wisdom in that approach, but there is also an important truth that often gets overlooked. More testing does not always mean better health. In fact, there are times when undergoing additional tests can create new problems rather than solve existing ones. Understanding this reality can help older adults make more informed decisions and avoid unnecessary stress, costs, and medical interventions. Modern medicine has achieved remarkable things. Diseases that once went undetected can now be identified early. Advanced imaging technology can reveal tiny abnormalities inside the body. Blood tests can measure countless markers and provide detailed information about our health. While these tools are valuable, they are not perfect. Every medical test carries limitations. No test is 100% accurate, and every test has the potential to produce false positive or false negative results. A false positive result occurs when a test suggests there is a problem when none actually exists. For older adults, this can begin a chain of events that leads to additional testing, invasive procedures, and unnecessary worry. Imagine a person who feels healthy and active but decides to undergo a scan simply for reassurance. The scan reveals a small abnormality that may never cause harm. However, once it is discovered, doctors often feel obligated to investigate further. Additional scans, biopsies, specialist visits, and follow-up appointments may follow. Weeks or months can pass while the individual lives with uncertainty and anxiety. Eventually, it may turn out that the finding was harmless all along, yet the emotional burden, financial costs, and physical risks associated with further testing were very real. Another issue with excessive testing is overdiagnosis. This occurs when a condition is detected that technically meets the definition of a disease but would never have caused symptoms or affected a person's lifespan. Overdiagnosis is particularly common in certain types of cancer screenings. Some slow-growing cancers may never become life-threatening, especially in older adults. However, once these cancers are identified, treatment often follows. Surgery, radiation, or medications may introduce side effects that significantly reduce quality of life. In such cases, the treatment itself may create more problems than the disease would have caused. Many people assume that early detection is always beneficial. While early diagnosis can certainly save lives in many situations, the relationship is not always straightforward. The value of a test depends on several factors, including age, overall health, risk level, and life expectancy. A screening that provides clear benefits for a younger adult may offer little advantage to someone with multiple chronic conditions or advanced age. This is why many medical organizations now recommend individualized screening decisions rather than automatic testing schedules for everyone. This psychological impact of excessive testing should not be underestimated. Waiting for results can be stressful. Uncertain findings can create fear and sleepless nights. Some people begin to view themselves as sick even when they feel perfectly well. They become consumed by medical appointments and constant monitoring. Instead of enjoying life, they find themselves worrying about possibilities that may never become reality. Health is not only the absence of disease, it also includes emotional well-being, peace of mind, and the ability to live without unnecessary fear. Financial considerations also play a role. Medical tests can be expensive, especially when they trigger a series of follow-up procedures. Even individuals with insurance may face deductibles, co-payments, and out-of-pocket expenses. For retirees living on fixed incomes, unnecessary testing can place significant strain on personal finances. Resources spent on low-value medical procedures might be better invested in activities that support overall well-being, such as healthy food, exercise programs, social engagement, or preventive care. One of the most important lessons older adults can learn is that good health care is not measured by the number of tests performed. Quality health care focuses on meaningful outcomes. A test should have a clear purpose. Before agreeing to any screening or examination, it can be helpful to ask questions. What is this test looking for? How accurate is it? What happens if the result is positive? Will the findings change my treatment or improve my quality of life? These questions encourage thoughtful conversations between patients and healthcare providers and help ensure that medical decisions are based on evidence rather than habit. Doctors themselves are increasingly recognizing the risks of unnecessary testing. Many healthcare professionals advocate for a more balanced approach that weighs both benefits and harms. They understand that every intervention should serve a meaningful purpose. Medicine is most effective when it is personalized, taking into account an individual's unique circumstances, values, and goals. For some people, less testing may actually lead to a healthier and more fulfilling life because it reduces unnecessary interventions and allows greater focus on habits that truly matter. Maintaining good health after 65 involves much more than chasing every possible diagnosis. Regular physical activity, nutritious eating, adequate sleep, stress management, social connections, and preventive care often have a greater impact on long-term well-being than an endless series of medical tests. Knowledge is powerful, but wisdom lies in knowing when information is useful and when it may create more problems than solutions. The goal should not be to find every possible abnormality, but to support a life that is active, meaningful, and enjoyable while making healthcare decisions with clarity and confidence. Reaching the age of 65 is a milestone that brings valuable life experience, greater perspective, and often a deeper appreciation for health. By this stage of life, many people have learned that every decision carries consequences, and healthcare is no exception. Making smarter medical decisions after 65 is not about avoiding doctors or refusing treatment. It is about becoming an active participant in your healthcare, asking informed questions, understanding your options, and choosing the path that best supports your overall well-being. As medical technology continues to advance and healthcare becomes increasingly complex, thoughtful decision-making becomes one of the most important skills an older adult can develop. Many people grew up believing that doctors always know best and that patients should simply follow instructions without question. While medical professionals possess valuable expertise, modern healthcare works best when patients and providers collaborate. Doctors can offer medical knowledge, but patients bring something equally important to the conversation: their personal goals, preferences, experiences, and values. A treatment that makes sense for one person may not be the right choice for another. This is why shared decision-making has become an essential part of quality healthcare. One of the smartest habits older adults can develop is asking questions before agreeing to any test, medication, or procedure. It is reasonable to ask why something is being recommended, what benefits are expected, what risks may be involved, and whether there are alternative options available. These questions are not signs of distrust. They demonstrate a commitment to understanding your healthcare and making informed choices. The more information you have, the more confident you can feel about the decisions you make. Another important aspect of smart medical decision-making is understanding that more treatment is not always better treatment. Many people assume that taking additional medications, undergoing more tests, or pursuing aggressive interventions automatically leads to better outcomes. In reality, every medical intervention comes with potential benefits and potential harms. Medications may cause side effects or interact with other prescriptions. Procedures may involve complications or lengthy recoveries. Diagnostic tests may reveal findings that lead to unnecessary treatments. A thoughtful approach considers both the advantages and disadvantages before moving forward. As people age, managing multiple health conditions often becomes more common. High blood pressure, arthritis, diabetes, heart disease, and other chronic conditions may require ongoing care. This can result in a long list of medications prescribed by different specialists. One challenge older adults face is polypharmacy, a term used to describe taking multiple medications at the same time. While each medication may have a legitimate purpose, the combination can sometimes create unexpected problems. Dizziness, confusion, falls, fatigue, and drug interactions may occur. Reviewing medications regularly with a healthcare provider can help identify prescriptions that may no longer be necessary or that could be replaced with safer alternatives. Smart medical decisions also involve recognizing the importance of quality of life. Medical care should not focus solely on extending life at all costs. For many older adults, maintaining independence, mobility, comfort, and meaningful relationships is equally important. A treatment that offers a small potential benefit but significantly reduces quality of life may not be the right choice for everyone. Understanding your priorities can help guide decisions and ensure that healthcare aligns with your personal goals. Preventive care remains valuable after 65, but it should be approached thoughtfully. Screenings, vaccinations, and routine checkups can play an important role in maintaining health. However, recommendations may change depending on age, health status, and individual risk factors. What is beneficial for a healthy and active senior may not be appropriate for someone with serious medical conditions. Personalized care is often more effective than following a one-size-fits-all approach. Accessing reliable information is another key part of making smarter healthcare decisions. The internet provides endless medical content, but not all sources are trustworthy. Sensational headlines, miracle cure claims, and misleading advertisements can create confusion and fear. It is important to rely on credible medical organizations, qualified healthcare professionals, and evidence-based resources. Taking the time to verify information can prevent unnecessary worry and help you make decisions based on facts rather than emotion. Family members often play an important role in healthcare discussions as people age. Trusted loved ones can help ask questions, take notes during appointments, and provide support when difficult choices arise. Open communication with family members can ensure that your wishes are understood and respected. Discussing healthcare preferences before a crisis occurs can make future decisions less stressful for everyone involved. Maintaining a healthy lifestyle remains one of the most powerful medical decisions a person can make. No medication can fully replace the benefits of regular physical activity, balanced nutrition, adequate sleep, social engagement, and stress management. These habits support both physical and mental health and can reduce the risk of many chronic diseases. Focusing on daily wellness often provides greater long-term benefits than pursuing every available medical intervention. Confidence also plays a role in smart decision-making. Some older adults feel intimidated by medical settings and hesitate to express concerns or ask for clarification. Yet, understanding your healthcare is your right. If something is unclear, it is appropriate to request an explanation. If a recommendation does not feel right, seeking a second opinion may provide valuable perspective. Taking an active role in healthcare does not mean challenging every recommendation. It means ensuring that decisions are made with knowledge and understanding. Aging brings wisdom that can be applied to every aspect of life, including healthcare. The ability to weigh risks and rewards, think carefully before acting, and focus on what truly matters becomes increasingly valuable with time. Smart medical decisions are rarely rushed. They are made through thoughtful conversations, careful evaluation of options, and consideration of personal values. By staying informed, asking questions, and focusing on overall well-being, older adults can navigate the healthcare system with greater confidence and make choices that support both longevity and age. Fulfilling quality of life.